Hi, everyone. My name is Jim Monahan. I'm the Health Communications Manager with the Michigan Vaccine Project. And today we're joined by Dr. Ida Rubino, who we've had on our webinar series a few times in the past. Today we're going to be talking about COVID-19 updates, basically where we are at this stage of the virus. I was doing some math earlier and I was shocked to realize that it's been 5 years almost since the virus first emerged in 2019. And since that time, I think there have been multiple vaccines, there's been new forms of vaccines, there have been booster shots, and then there have been updated shots. A lot of information has changed, and I think a lot of folks, like myself included, are just wondering, where are we now, and what is the current recommendations? Do you mind just starting off by giving us a brief introduction again to who you are, and then we'll get going with the questions?
Sure. Hi, everybody. I'm Dr. Ida Rubino. I am a family physician. I work for Corewell Health, Beaumont Legacy Troy East, so the old Beaumont Troy Hospital, now part of Corewell Health. I see patients there on their Sterling Heights campus. I'm also part of the faculty at Oakland University William Beaumont School of Medicine and teach medical students there.
Great. And thank you again for joining us. I've heard that by now most people have either had COVID-19, been vaccinated against COVID-19, or both. Is this true? And if so, is COVID-19 still a concern?
Yes. Back in 2020, we heard a lot of talk about herd immunity, where the majority of people would have some baseline protection, whether it be antibodies from a vaccine or from actually having COVID or being exposed to it. Yes, most people now have either had COVID-19, a variant of it, or a vaccine, or even a vaccine series. But much like flu, which people are familiar with, I do think COVID-19 is here to stay. It's a virus and it does mutate. Viruses are smart. They change to avoid being protected by antibodies. And when they mutate or change, they sometimes can become stronger, but they always become different. And so the body has to find new ways to protect themselves against the new variant of the virus. So COVID-19 is still here. There are new variants. We will need new vaccines in the future to help continue to protect people against COVID-19.
So it sounds very clear, yeah, that COVID-19 is still here. It's still a concern, and there's still a need for vaccination. So, with that being said, what are the current vaccine recommendations for those who have been vaccinated against COVID-19 and those who haven't? Is there a difference between the two groups?
Yes, so many people remember when the vaccine was first approved, there were different forms. There was the Janssen brand name, which we no longer give. There was the risk of blood clots with Janssen. So that is not even an option anymore. There was the newer technology used in vaccines, not a newer technology overall, but for vaccines, the messenger RNA technology. And people had a lot of questions, but I think now most realize that if they had the Pfizer brand or the Moderna brand of the COVID vaccine, it did use the messenger RNA technology, mainly to target that spike protein on the virus. And both are still around. And if people remember based on their age, if they had COVID, if they had a previous dose of the vaccine, the recommendations could vary, whether they would need a primary series, meaning 1, 2, or 3 doses of a vaccine, whether they would need a booster dose. And then after that, a new brand name was released, the Novavax vaccine, which used some old technology, not a messenger RNA vaccine. And that's also still currently an option. So currently we have the messenger RNA technology. The brand names are from Pfizer and Moderna, as well as the Novavax. All are still options. What has changed is that the vaccine is what we call monovalent, meaning it's no longer bivalent. There's just one strain of the virus covered in the current 2023-2024 vaccine. The older bivalent, when you heard about the Delta variant of the virus, the older bivalent vaccine is no longer available. So the current monovalent vaccine is still available and still being given. Is it as effective as when it was first released? No, but there is some cross protection with the current variant of the virus. So we can still give that. But what's happening is that the FDA recently met, as well as the ACIP, the Advisory Committee on Immunization Practices. And this is a group of experts who get together, make decisions on vaccines in conjunction with the FDA. They are going to release a new COVID vaccine for the fall. It will still be monovalent and will cover protection against the current variants of the virus. both the messenger RNA as well as the Novavax. So there will still be two different types of options for people. Now, what's also changed is that people no longer need to complete a primary series in general. Currently, based on age, for some childhood age groups, they still recommend a primary series. For some folks at higher risk, they still recommend a primary series. That may change when the new vaccine is released in the fall. We just haven't had the updated recommendations now. But in general, the current recommendation is that people just get one dose of the current monovalent form of the COVID vaccine. Again, to be changed in the fall. People often ask me, should I get the COVID shot? Because they know people who have COVID. We actually are still seeing it in the office. And I discuss with them that it still is effective. There is some cross protection against the current variant, but we will be getting a newer vaccine in the fall. Currently, the only folks who the CDC recommends gets a second dose if they've already had the current COVID vaccine are our patients 65 and older, who tend to get sicker and maybe are at higher risk of being hospitalized or even death. And so if they've had the 2023-2024 monovalent vaccine, if 4 months or more have passed, we do recommend that they get a second dose. For all other adults, just one dose.
Great, great. Thank you. That's very clear. We've heard a lot about, and you've mentioned this multiple times now already, just about variants, and there's always a new variant circulating. You mentioned that the virus mutates. What are the dominant variants at the moment? Are we still, all these variants, are they still part of the Omicron tree that was so prevalent a couple years ago? And I think you already touched on this, but you have mentioned that the current vaccines do work against multiple variants, it seems.
Yeah, there's some protection against the current variants. Perhaps people have heard about flirt on the news, which is the word being used for the current variants of the COVID virus. So last year we saw Omicron, and that is at that time, that's when the monovalent current vaccine was made based on its protection against the Omicron variant. Then it evolved into what was called the JN1 variant. And currently the most prevalent variant is the KP2. So the current vaccines, again, not finalized yet, but depending on whether you're looking at the messenger RNA vaccine or the Novavax vaccine, will most likely cover either the JN1 or the KP2. And it's possible, I don't know for sure yet, that each will cover a different variant. That hasn't been released yet. So different than the current vaccine that we have in that it's more specific for the current variants that we're seeing, which on the news they're calling flirt. I think because it's probably easier to remember than all the letters and numbers that we read about.
Yeah, that makes sense. I've definitely been hearing about that. Okay, actually, I recently got the flu about 7 months after I had gotten my flu vaccine. So it made me realize that maybe some of that immunity had waned. But I received my last booster shot for COVID in the fall of 2023. So my question relatedly is, am I still protected against COVID?
Yeah, so we see flu all year and we see COVID all year. We give the flu shot early fall to protect for the year. There's currently no recommendation to get a booster shot of the flu vaccine unless you're a child under the age of 8 getting it for the first time.
Hmm.
With COVID, and if you had the current vaccine, and the only one that's currently available is the 2023-2024 that is monovalent and protective against the Omicron, which is how it was designed. If you've had that and you're under the age of 65, there is no recommendation to get a second dose. Over the age of 65, yes. And as I mentioned, folks over 65 are at higher risk of hospitalization or severe illness, but also for the reason you mentioned, in that immunity does wane over time. So current recommendations for 65 and older are to wait 4 months and get a second dose. But for you personally, if you had the current vaccine that's available now, no, you would wait until the fall and get the new one.
Okay, good to know.
Once it's released, hasn't been released yet.
Again, I think you've touched on this, but let's just make sure we're covering it. If I haven't yet received a booster, can I still get the newest one? Am I still able to get past boosters? Would there be a reason for doing that?
So, that the term primary series and booster is becoming less and less applicable to the COVID vaccine. A lot of vaccines, we recommend a primary series, which it's a series of required doses to give people that baseline immunity. Definitely applies to children and a lot of the childhood vaccines. And as we study, immunity starts to wear off, and then a booster dose is required. In many cases, that booster dose is the same vaccine, such as tetanus. We've noticed that. You give a tetanus dose every 10 years unless people have a dirty wound because immunity wanes and you need to boost immunity. With the COVID virus and the COVID vaccines, because the virus is mutating, and much like flu, we're going to need a new form of the vaccine each year, most likely. The older version of the primary vaccine that we were giving, the bivalent form, is no longer available and no longer recommended because it is no longer effective. So currently, there's only one available form of the vaccine. I mentioned there's different brand names and different technology, but the coverage is the same, and it's a monovalent, only one available. So no booster doses. And we'll see what happens in the fall when the new vaccine is released. Most likely, it will be a similar recommendation where there's no booster dose recommended unless you're 65 or older, or certain childhood age ranges, or certain risk factors. So immunocompromised patients, perhaps on chemotherapy or immunotherapy. There may be exceptions to that rule, but the general adult population without underlying health conditions at this time, there's no booster dose recommended for the current vaccine. I
Great.
believe the recommendations will be very similar when the new one is released, but we'll see.
Yeah, so you would expect it might be an updated shot and not a booster of the existing shot.
I can say that with most certainty. Yes,
Okay.
it will not be a booster of the current shot, much like flu. It'll be similar technology. Now, flu is currently what we call quadrivalent. So there's 4 strains in the current vaccine. It may not be. It may not all be quadrivalent this year, but that's how we term it. But then in the fall, we get a new vaccine based on the circulating virus that we're seeing in communities. I believe COVID will be the same, so it won't be a booster dose of a same vaccine that we see currently.
Good to
I'm
know.
sure of that. Yeah.
So there's been a recent spike in COVID-19 in several states, including we've been hearing about the flirt variant in the news. What are some reminders you can offer folks about staying safe this summer and maybe even as we head into a new school year?
Sure. Yeah, we're definitely seeing COVID. People probably hear less about death and less about hospitalizations and maybe assume that the virus is more mild. But I think what's really happening is people have some baseline antibodies. So we are better protected, but we still are vulnerable, and COVID is still contagious. And like many vaccines, even if you've had the vaccine, like you mentioned, it may not 100% prevent you from getting COVID. You may get it and not be as sick or have a lower risk of being hospitalized. So you still want to take those same precautions. Now, we're fortunate in warm weather because we can gather in well-ventilated areas or even outside, but we still need to use common sense, wash our hands, wipe down surfaces. If you're sick, stay home. Don't get together with large groups of people, and wear a mask. It's very acceptable nowadays. So often in the office, I still wear a mask, especially if patients are coming in and not feeling well. So very similar common sense things. Stay home if you're sick, especially if you're going to be around a baby or somebody in treatment or an older person.
Great advice. What is the tentative plan for an updated COVID-19 vaccine or booster this fall? But we'll say actually just updated vaccine. And will it be the same for everyone, or will it be a different recommendation maybe for those over 65 or those who are immunocompromised? What are you thinking?
So I know the ACIP already met and also met with the FDA to agree on whether the JN1 variant or the KP2 variant will be in the vaccines. And it's possible that the messenger RNA vaccines will contain one variant protection and the Novavax may contain another. And part of that has to do with how rapid these technologies work at making vaccines. But currently, it's not been released yet, but I know that the protection will be against one or both of those variants and will either be messenger RNA technology or the older technology used for the Novavax vaccine. Now, the age indications are different. So the messenger RNA vaccines from Pfizer and Moderna are for 6 months and older, whereas Novavax is 12 and older. The guidelines that the CDC puts out will be updated, and it will be based on age, how many vaccines people have had previously, and underlying health conditions. So my guess is for kids who are a little bit higher risk, perhaps 6 months to 4 years, which currently is the recommendation, they may be eligible for more than one dose to prime their immune response. My guess is 65 and older will continue to recommend 2 doses 4 months apart. But folks in between the age of 5 and 64 who are healthy without underlying health conditions, not pregnant, more than likely it'll be 1 dose. Young males or adolescent males tend to navigate toward the Novavax technology because there is that risk of myocarditis with the messenger RNA technology from the COVID vaccine. And most of the time, it's mild and people get better. And keep in mind that the risk of myocarditis with actually getting COVID tends to be a little bit higher and more severe. So the Novavax is an option for our young adolescent males who don't want to get the Pfizer or Moderna vaccines.
Great. Really good to know. And then are there special recommendations for pregnant women?
Currently, it is recommended, but again, the new guidelines are not out yet. So currently 1 dose. What's interesting in pregnancy to give a vaccine, especially during the third trimester, when mom has at least 2 weeks to produce those antibodies and has a chance of passing them through the placenta to the baby can be protected. So we take advantage of that with the flu vaccine in the third trimester and even a Tdap, which is tetanus, diphtheria, and pertussis to give baby protection against whooping cough. But in each of those cases as well, it's just a 1 dose with the hopes that the 2 weeks that it takes mom to mount that antibody response is enough time that baby can then benefit from the antibodies. Because keep in mind, much like the flu vaccine, we cannot give a COVID vaccine under the age of 6 months.
Great. All right, we'll be looking out for this new updated vaccine and adjusting our educational outreach efforts accordingly. Is there anything else about the sort of current state of COVID or the vaccines that we haven't talked about that you'd like to mention?
I think people need to know what a fabulous job our Michigan Health Department does, the MDHHS, Michigan Department of Health and Human Services. The vaccine nurse educators have put together excellent education resources, both for patients as well as providers. And they will be very involved in updating these recommendations once we know more about the new vaccine. And they'll make sure that the public is aware of that. But as I mentioned, COVID is here to stay. We see it all year. So just please continue to use common sense. Stay healthy in general. If you're sick, stay home. Remember to wash your hands, wear a mask anytime you don't feel well. The isolation guidelines have changed, much like other viruses. So with flu, with RSV, even now with COVID, if you test positive, stay home until your symptoms improve and you do not have a fever for 24 hours. And then if you choose to go out and resume normal activity after that, wear a mask, wash your hands, wipe down surfaces, just take precautions, much like any illness that you would have. So those guidelines have changed, but again, it's common courtesy and common sense.
Mentioned, but people will be encouraged to get your flu vaccine and your COVID vaccine at the same time.
Oh, yeah, I should have said that. Yeah, you can get the COVID vaccine the same day as any other vaccine. So yes, to get it done the same day, and they both can cause a sore arm. So maybe do it in different arms. And patients often ask me, and I don't know the answer to this, will there be a combo where you get flu and COVID the same day? And my guess is no, because the technology is different.
Mm.
But I don't know if I've heard rumors of that. At this time, I'm not aware of that. Nobody wants the COVID vaccine. I could have touched on hesitancy, but it's just, and they group it with the flu vaccine. So it's been really a challenge to counsel patients to get this. There's some interest in RSV with older people. So that one is not as hard to convince, but we'll see what happens in the fall. Hopefully people will still get it.
Wow. Great. Really good advice. Thank you again for sharing your expertise with us today. We appreciate it.
Thank you for inviting me. Nice to see you.
Yeah, you too.